And welcome to this edition of Need to Know. I'm Julie Phillip. The local congressional delegation returned from Washington this week and immediately started talking about health care reform.
Do all of you know that your health care insurance has a lifetime cap on it? And if you were to have a severe head injury, you could use that up maybe in 6 months and you'd never be insurable in the United States again as long as you live. That will be gone. The yearly limit will be gone. If you need an operation and your company says, "Oh, I'm sorry, we don't cover that," then that can be taken care of by a board of doctors who will say this is necessary for life, and you will get it. That's just part of what we're doing. What we're doing for long-term care, for prevention. If we can insure 45 million people and keep them out of the emergency room for hospital care, we're going to save an awful lot of money.
Politicians are using the August recess to shore up constituent support for various health care reform measures. But some of their constituents are stepping forward with messages of their own. About 24 people protested outside Congressman Eric Massa's Pittsford office Tuesday, pressuring him to support the House's health care bill when Congress goes back in session next month.
I know that this is a very complex problem, but we send people to Washington to work hard to find solutions to these problems, not point fingers or make excuses for a lack of action that results in the status quo.
Massa, a Democrat who was elected on a platform that included single-payer universal health care, does not support the House bill. He says it's partly because it doesn't go far enough. Massa was unable to join us today to talk about his opposition, but we are very pleased to have Congresswoman Louise here, and she's chair of the House Rules Committee and a Democrat. Thank you for coming in.
Thank you for having me.
Any kind of bipartisan solution to health care reform is going to require compromise. What are some key components of this House legislation, though, that you do not want to compromise on?
The public option. The public option. Look, as I said in your clip there, 49 million people right now don't have any insurance except the emergency room. It is extraordinarily costly. If we were able to insure them with a public policy, which will perhaps be subsidized given that whatever their income level may be, but to make sure that their children are given the shots that they need, that they are kept healthy and practice prevention rather than going into the emergency room, oftentimes when they're far sicker than they would have been if we could have gotten to them earlier. We can't quantify that for the counting office in Washington because you can't quantify saving of some money that you did not spend. I hope that makes sense. But there are numbers of ways that we expect to be able to do that. One is we're going to squeeze the enormously high cost out of insurance. For example, as I pointed out, too, that I'm not sure everybody knows they have a lifetime cap on their insurance. This came up during the Clinton health care bill. At that point, it was about $1 million. You also have a yearly cap. I've just been notified by my new insurance company. Now, let me make it clear, I don't have government insurance. I am on my husband's Kodak policy,
so I've heard, yes,
which is watered down considerably, that I'm about through this year. So for medication.
So you will not accept a bill that does not have a public
And everybody
option.
wants to know if I would be a part of it. You bet I would. It is going to be a series of choices of the kind of health care that you need. At various prices, but you you decide on the policy that fits your life. You may be a single person. You may have numbers of children with
so whatever the compromise that might be reached, it has to have a public option for you to vote yes on.
I absolutely. Well, I'm not going to go that far because I want to see what they do come up with. There's some talk about a co-op, which I don't think would be nearly as good.
A co-op meaning that they would collectively bargain insurance rates for people who would then be required to have insurance.
Now, before we go any further, Julie, I want to say what the biggest difference is here in the Clinton health care bill. We were out there by ourselves in the Clinton bill. Now, the American Medical Association is fully supportive of this bill. I hope everybody understands that. The pharmaceutical industry is supporting this bill. AARP is in support of this bill. Some insurance, to some extent, is not, but we have good evidence that they are supporting the riots that are going on. So you feel this is in a much better place than the Clinton health care reform Much better place, much better. But it's not a new idea. Harry Truman tried to get health care. Richard Nixon tried to get health care. This happens every time, and during the Clinton health care, we had to close down a hearing because the John Birch Society had terrified everybody in the room at Fairport High School.
It raises a lot of...
So this, no, I think a lot of it's organized. This is not a spontaneous uprising of people who are concerned. I hope nobody believes that. Seeing the phone calls that come into our district offices would tell you better than that.
You're saying it's corporate funded by insurance agencies and others who are...
It is absolutely. MetLife, as we understand, is one of the funders there. But the interesting thing is that two of the biggest groups that are paying for all this and giving it the tips, which say go early, call a member a liar, rattle them, and take over the crowd, right. Which is, we've seen the talking points.
Because we don't have a whole lot of time today, right. I want to get to this next question. And we've touched on it a little bit, all the different interests that are involved in making healthcare reform a success. I want to walk through some of those interests and have you tell me what you hope they'll do to make this work. And I'm going to start with doctors and nurses.
Doctors and nurses are supportive of this bill. As I said, the AMA and the nurses signed on very early.
But what in the bill, what are they giving?
Because they are the people who see every single day. Their expertise,
they need to change
their
what
knowledge.
they're doing?
Yes, I think one of the most important things that we're doing here is we're going to be changing the way that Medicare is paid for. For example, instead of what we call fee-for-service, and so that every test you give you are reimbursed for, it's going to have to do more with outcomes. There are hospitals that have been great leaders in this. Mayo's, Cleveland Clinic, Cooperstown was written up in the New York Times as one of the best. But a lot of doctors' hospitals in the Southwest, and McAllen, Texas, stood out as the biggest example of overusing the system. We're going to squeeze all of that out. Yes. In addition, this bill says 85% of the premium dollar must be spent on health care. Right now, 1 or 2% is or not. It depends on the agency. Their profits have gone up, risen so high, I think something like 245% in the last few years. The salary for most of the 7 top companies is well over $20 million, plus incredible bonuses a year. Mm-hmm. This is the kind of money we want to put back into health care.
Okay, well, let's move on to the insurance companies. Mm-hmm. What do they need to contribute to make reform work?
Well, they have to decide that they're going to spend more money on health care. They have to get with the program. And they don't have that much to lose. In the public option, they have the possibility of 49 million more customers. I cannot understand their fight against that at all, nor can I understand anybody's fight against competition. That's what American capitalism is based on. They have no competition. We want this bill to give them some.
Okay, next one is the drug companies, the pharmaceutical industry. What do they need to do to make it work?
They have promised $80 billion cuts in cost of drugs for seniors.
Is that enough?
Well, I'm not that delighted with that part. I'm happy to have their support. But one of the things we needed to do is to be able to negotiate with drug companies for pricing, as we do in the Veterans Administration and the military. But I think that was part of the price of their joining us. That's too bad. But the cap that I talked about will be gone. The yearly caps will be gone. There are really incredibly good things in this bill for nursing homes, for people who are disabled, home care. But all of it with oversight, special oversight for what we're doing there to make sure that it's not overused. For example, in the Medicare system, the medical devices, almost no oversight over those. We know instances where people who simply have a storefront or a post office number will
so there needs
bill
to be
Medicare.
More regulation and keeping on top of these things.
Well, we have to make sure that it's being done correctly.
Unfortunately, we only have about a minute left, and I want to touch on what everyone else is saying, and that patients also have some responsibility here, that consumers have to make healthcare reform work. What do you hope they're going to do?
Well, I want people to start thinking for themselves. And not just follow the current whatever they hear out there. And but we all know that our diet has so much to do with how healthy we are. Smoking, heaven knows the price of cigarettes now. I don't know how anybody can even think about affording. Smoking costs us billions of dollars a year in health care costs. Obesity does as well. We're working very closely with children,
so
but this is a major part. Prevention is what health care should be about. What it is now is just treating sick people. It's the well people that we need to reach and keep them well.
Thank you so much for coming in today, Congresswoman.
Happy to be here. Thank you for the time.
That is Congresswoman Louise Slaughter. And next week on Need to Know, we have Republican Congressman Chris Lee scheduled. WXXI will be bringing you much more on healthcare reform in the coming weeks. You can keep up with it by going online to WXXI.org/healthcare. In addition to local radio and television reports, you'll be connected to in-depth programming on healthcare reform from PBS and NPR.